Coming up on Medwatch today, protecting precious cargo. We'll break down car seat safety with advice on how to make sure you're doing what's best for your family. Doctors are seeing an increase in emergency room visits, the symptoms they're seeing, and how it's related to a recent change in California legislation. How your genetics can play a role in your health, and how doctors are using science to help treat, even prevent certain cancers. Hi there, and thanks for joining us. I'm Julie Musgrave. A recent study published in the Journal of Pediatrics revealed there's still a lot of confusion when it comes to car seat safety. One of Community Regional's safety educators showed us the do's and don'ts when it comes to transporting our kids.
Make sure that you're installing it correctly.
It may seem like a lot. Car seats often leave many parents confused, but Eliana Troncale, an injury prevention specialist at Community Regional Medical Center, can help make the safety rules and use make sense.
Right off the bat, I can tell that
we followed along as she met with Claire Silvera, a proud great aunt to little Jolene, who turns 1 in a matter of weeks.
And I transport her at least, I would say 4 times a week in my car.
Claire admits she's not 100% sure about the guidelines.
I want to know if she's in the correct car seat. If we do need to move her up, then we need to, and that will make me feel a lot better.
First place to start is your car seats manual and also your vehicle manual, actually, because you want to compare the two.
Eliana says you want to first make sure that you're using the right seat for your child. You should consider weight and height, not age, when picking one, and price does not matter.
So every car seat goes under the same testing. It's all federally regulated. So if you get a more expensive car seat, it's not necessarily safer than a middle of the range car seat.
There are 3 types: infant, convertible, and booster. Jolene is using an infant seat that uses a base to install.
With this particular car seat, you should be using the lap and shoulder belt when installing it, because that's going to give you a more secure fit. It shouldn't move more than an inch side to side.
Next, check the straps.
With the harness, it's very important that it is tight and that the clip is at armpit level. This is a little low. You want to have it up tight so that she has a nice secure fit. And then always do the pinch test. If you're able to grab any of the harness, it's too loose.
California law requires children to be rear-facing until they are 2 years old or 40 pounds and 40 inches.
Even if their legs are a little long, the more important part is that there is room between the top of the head of your child's head and the top of the shell of your car seat.
After this check, Eliana recommends Jolene go ahead and move into a rear-facing convertible seat. Eventually, she'll turn around, and in a few years after that, she'll be in a booster. That's usually between 5 and 10 years old.
The safest place for a child is the middle seat.
Claire says the advice gives her peace of mind and is something everyone should know, not just parents.
Grandparents, aunts, uncles, friends, whoever's transporting these little children, I really feel that they need to know the rules.
After all, car seats have an important job, protecting our most precious cargo.
Another tip, don't put your kid's jacket on while in the car seat. It adds an extra layer of material that prevents the straps from being secure. Instead, put a blanket over your child. If you'd like to have your car seat checked out, contact your local CHP, police department, or go to safekids.org for a list of car seat technicians in your area. Emergency room visits are up, and doctors are saying there might be a link between recent California marijuana legislation and the symptoms many patients are experiencing. Dr. Race Vora explains.
Right now, we are seeing an increase in emergency room visits. So, doctor, we want to talk to you about why exactly we're seeing that. You guys are kind of linking it back to one particular thing. What is that?
Yeah, you're basically hearing a lot of news stories about people that are increasingly exposed to marijuana, especially in this era of increased availability and the deregulation that we've recently experienced. More and more people in our community are experimenting with this substance and using it perhaps on a more frequent basis than they were before. And we're seeing several different types of emergency department visits related to it. In the adults, what we tend to see is people that may be using it chronically or are using it on a habitual basis, and they end up having something that we call the hyperemesis syndrome. Sometimes it's known as the cannabis hyperemesis syndrome. And that's characterized by, it's an unusual picture in that they just have a lot of vomiting and nausea, and it can be lasting days to weeks, and the only thing that seems to relieve it, for some weird reason that we're still trying to figure out the science behind, is that they have to take very hot showers. The strains that people may be using are more potent than they have been in the past. They're probably using them at a frequency that's greater than they have before. And there may be patient factors where the more people in a population are exposed to it, the more we are able to discover some of these complications that were very rare before, but are now coming to the fore and becoming more common now.
What are some of the main symptoms that you guys are looking for to attribute?
Typically severe vomiting, dehydration, abdominal pain, diarrhea sometimes occurs. People just are not very happy.
Why do you think there's such an uptick in that?
Well, that's a great question. Certainly, we're seeing more people in the community using this substance, either recreationally or for medicinal purposes. And we're also seeing that there's different strains that are being developed, and they're more potent than what we've seen in the past. And I think the combination of those factors is leading some patients to have this complication.
And it's interesting to note, too, that it's not just smoking marijuana. There's other ways.
That's correct. Smoking is just one way that people are able to get access to the marijuana. There's also edible products that they can use. They can actually get access to butter or oil and then use that in their cooking, or just get edible products ready-made that contain the THC and other oils that would contain the marijuana substance. There's even creams and lotions that people are starting to use for neuropathic pain and other types of pain symptoms.
So what do you think the solution is? How do we fix this problem?
Great question. The science is still not quite worked out, so we're still learning more and more about exactly what's going on in a person's body by the time they get this syndrome. And once we establish the diagnosis that this is the hyperemesis syndrome related to cannabis, then we can start to retreat the patient with rehydrating them with either IV fluids, or if they can drink fluids after we give them some nausea medicine, we can try to give them some nausea medicine. What we do know is that once people stop smoking or ingesting the marijuana, that this syndrome seems to kind of cure itself. So what we tell people is, if you could just stop the exposure, that this syndrome will take care of itself sooner or later. And in the meantime, we'll try to do other medications and see what works.
Okay, certainly we need to be careful.
That's right.
Doctor, thank you so much. We appreciate your time.
Coming up on Medwatch today, there are new recommendations out when it comes to teenagers and depression. Plus, the end of an era for one of Community Regional's respiratory therapists. He's retiring, but he's not disappearing from all of his duties just yet.